save lives through the gift of donation, because without organ donation, there would be no transplantation. Here today to talk about this further is Dr. Glyn Morgan, Chief of Surgical Transplantation at Hartford Hospital. And Dr. Morgan, thanks so much for being with us here today.
Thank you very much for having me.
So describe for me, if you will, the partnership between organizations within the donation and the transplantation community. How does that work?
Yeah, I mean, you alluded to it in the question. The fact is, transplantation is really a two-pronged enterprise. Obviously, what we do in the transplant center with recipients and listing patients and getting the transplants done would never happen if it were not for the donation, for the gift of life, whether that's living donation or donors from deceased donors. So it really is a very close and symbiotic relationship, because neither of us can do the important work that we do without the efforts of the other. So working with the American Liver Foundation, the National Kidney Foundation, and Donate Life Connecticut are critical to our overall mission.
Doctor, we hear so much about liver disease. What leads a patient to seek care for liver disease?
Yeah, that's a great question. You know, liver disease is often very quiescent. It can be asymptomatic for many, many years. The liver has an amazing capacity to carry on and not really give outward signs and symptoms. So having regular checkups with your doctor, which could include an annual survey of liver function tests, perhaps even an ultrasound if there's suspicion for liver disease, is really critical, because it can be asymptomatic for so long. If you actually develop outward symptoms, the things to look for are yellowing of the eyes, yellowing of the skin, developing or accumulation of fluid in the abdomen, vomiting up of blood, developing swelling in the extremities, in the feet. Those are some of the obvious outward signs that you may have advanced liver disease. But the key is to try and identify it early on.
When is it time to think about a liver transplant if you have a liver disease?
Yeah, luckily, relatively few people that have liver disease will ever get to the point where they need a liver transplant. But the key is getting into the system, identifying your caregivers, the people that can help you get to navigate along the way. So a gastroenterologist, or more specifically a hepatologist, someone who specializes in liver disease, can identify when you may need to be on the eligibility list for a transplant. So any of the so-called end-stage complications or potentially life-threatening complications that I alluded to before, vomiting of blood, turning yellow, accumulation of fluid, those are all sort of warning signs that you better get yourself into the office of a hepatologist and perhaps even into a transplant center.
Dr. Morgan, to our viewers across Connecticut watching this right now, what can they do right now to make their liver healthier? Things they should avoid or things they should be eating?
Yeah, I mean, it's interesting. A lot of people equate liver disease with alcohol addiction or alcohol abuse. And there's so many liver diseases that have nothing to do with alcohol injection. Non-alcoholic fatty liver disease is a great example. It's also very, very common in people with what we now refer to as metabolic syndrome, watching our weight, watching our diet, if you're diabetic, controlling your sugar, all those things. But the key, because it is such a complex organ and there's so many sort of angles to it, is to get into see a hepatologist or at least a gastroenterologist that has a special interest in liver disease or can refer you to a liver disease center such as the one we have here in Hartford.
Dr. Glyn Morgan from Hartford Healthcare, we appreciate you joining us today. Thanks for that insight.
Thank you very much for having me.